right. Welcome, everyone. I'm happy to have you joining us today as we have a conversation in regards to regulating healthcare social work and building equity, advocacy, and trust through stronger regulation in this area. I want to begin by acknowledging that the Nova Scotia College of Social Workers is in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq. The Peace and Friendship Treaties signed between 1725 and 1779 recognized the inherent rights of Mi'kmaq without surrendering their land, resources, or sovereignty. These treaties, reaffirmed in Section 32 of the Constitution Act of 1982, remain active today, establishing an ongoing relationship between nations. As treaty people, the NSCSW is committed to reconciliation and is grateful to live and work in Mi'kma'ki alongside our members and communities. I also want to take time to acknowledge that the NSCSW firmly recognizes that reparations are both a moral and material obligation to address the deep-rooted history of anti-Black racism in Nova Scotia and Canada. The history includes human rights violations and systemic disenfranchisement faced by African Nova Scotian communities. We are unequivocally committed to engaging with our members in proactive efforts towards reparations for the historical enslavement of peoples of African descent. This includes addressing systemic barriers and advocating for equity and justice for African Nova Scotian communities. So I wanted to take some time to introduce a little bit more what we're talking about today. And then I'm really looking forward to hearing back from you on this approach. So the college is dedicated to ensuring the public receive safe, ethical, and professional social work services that align with the core values of social justice, equity, and community well-being. This commitment is fulfilled by the college by defining scopes of practice, establishing ethical standards, supporting professional development, and advocating for policies that advance justice and equity. As part of this mission, the NSCSW is exploring the regulation of social work in Nova Scotia's healthcare system. Of course, this area is critical and intersects with systemic barriers, patient safety concerns, ethical complexities, and professional challenges. Through the college's Safer Social Work Framework, we aim to develop a regulatory approach that prioritizes public safety, professional accountability, and equitable care. This is a scoping project at this point in time, so we haven't developed all of the policies or the regulatory tools we're going to talk about. What we're discussing today is what we believe might be important here to strengthen the delivery of healthcare social work across the board. To do this, we've addressed some core risks in the healthcare delivery, as well as understanding our strengths. And ultimately, we seek to empower social work in the healthcare setting, specifically to serve most structurally vulnerable populations. The college's regulatory strategy is guided by a post-structural philosophy and a right-touch regulatory model, ensuring that its practices are both adaptable and minimally intrusive. This approach aims to recognize the dynamic realities faced by healthcare service users and social workers who navigate interdisciplinary teams, challenge systemic inequities, and respond to the diverse and evolving needs of individuals and communities. This approach is also informed by critical reports such as the Truth and Reconciliation Commission Call to Actions and the Mass Casualty Commission's final report. And our regulatory approach is meant to be evidence-based and aligned with the broader societal goals. Particularly within the healthcare context, the college has identified key priorities, including regulating a clear integration of the social, economic, and environmental impacts on health policy, establishing clear competencies for a biopsychosocial spiritual model of care within our healthcare systems, and developing resources to educate health systems and service users about social work scope of practice. So in order to do this and to engage in this work, the college did create a healthcare committee. I see some members of that committee joining us here today. Michael Earle is our chair. I see Jim Morton has joined us as well, who have helped shape this conversation and this initial scoping statement as we move forward in discussion. So The Health Committee is an ad hoc committee of council tasked with investigating the role of social work in healthcare delivery and exploring some of the regulatory measures that might be required to ensure uh, greater safety. Robin is saying my slides aren't sharing. Thanks for that, Robin. Let me try and reset that. Robin, can you see some slides now?
We can see it, Alec.
Thank you, Michael. So investigating the role of social work in healthcare delivery and the regulatory tools that might be needed to support the work here. The committee is also focused on addressing the challenges posed by the dominance of the medical model, neoliberal paradigms, managerialism, while working to strengthen safe and ethical social work practices to enhance quality care and community well-being. This presentation will explore a number of things: the historical context of social work and healthcare, some of the current challenges identified by both communities and the literature, as well as by social workers. It aims to analyze some of the systemic barriers and propose regulatory improvements that are aimed to help healthcare social workers not only deliver safe and ethical practice, but to advocate for equity, justice, and public well-being. We aim to foster a collaborative process that engages both the healthcare system, social workers, community groups, ultimately to co-create regulations that serve the public interest. I hope my slides change there. So the methodology for this scoping project also is a commitment to how the colleges advances policies. So we've attempted to be participatory and inclusive, and really integrating qualitative methods to capture lived experiences of diverse communities, social workers, and to really capture the systemic barriers that we see in the delivery of healthcare. So to do this, we engaged in intentional collaborations with multiple groups over the last year, from our partners at the Mi'kmaq Native Friendship Center to our partners with the Association of Black Social Workers, who helped us engage with community members, to the Acadian population, LGBTQ2SIA, newcomers and disability advocates, as well as seniors. We're all engaged to help form the basis of this scope. And ultimately, again, the college's commitment is to that public interest, and co-creating policies with the public is a core part of how we ensure equitable regulatory policy. Our next round of consultations will be focused on engaging with social workers and healthcare leaders and using surveys. You'll receive a survey after this to help us further develop and flesh out the concepts here. And we are going to continue from now until the end of June with consultations like this one. Again, our analytical framework is aimed at our commitment to decolonizing social work practice and ensuring a reparative perspective to address inequities, challenge colonial legacies, and promote more culturally responsive regulation and practices. We've also, again, conducted a literature review to examine the history, evolution, and the current state of healthcare social work. So again, we've rooted this in a collaborative approach, actively involving community partners. And again, we're prioritizing engagement with structurally vulnerable populations to get a sense of the inequities and what we need in order to gain more culturally responsive practices. Integrations for these findings have been synthesized from focus groups as well as consultations in literature to develop a regulatory framework rooted in the context of healthcare delivery and the complexity that delivers there. Ultimately, again, our hope is that through this approach, we will have good, robust policy that further advances healthcare social work, is ethical, and really supports the needs of service users.
Yeah, or I can call him. I think I have his number from last.
So looking a little bit about the historical foundations of healthcare and social work. So healthcare social work emerged in the early 20th century during the Progressive Era, addressing the social determinants of health to improve individual and community well-being. Of course, early milestones included things like the settlement house movement and the founding of a medical school, the founding of medical social work at Massachusetts General Hospital in 1906, which integrated social services into medical care. In Canada, pioneers like J.S. Wordsworth emphasized the connection between social conditions and health, laying the foundation for holistic care and social work education. The historical foundations established the profession's focus on addressing systemic inequities and supporting vulnerable populations, which continue to shape the evolution today. The history of healthcare social work also includes significant ethical lapses that have left lasting impact on marginalized communities. This includes involvement in the eugenics movement, residential schools, and the 60 Scoop, which targeted Indigenous communities under the guise of child welfare, contributing to the genocide of Indigenous peoples in Canada. Similarly, African Nova Scotians face systemic racism in healthcare, with social workers often failing to challenge discriminatory practices. These injustices underscore the need for accountability, reparative action, and a commitment to ethical practice within the profession. Sorry. Jumped way ahead there somehow. So, despite its challenges, healthcare social worker has also demonstrated resilience and adaptability. The profession has evolved to address complex issues such as mental health, systemic inequities, and public health crises. Social workers have played a pivotal role in advocating for equitable access to healthcare, supporting marginalized populations, and integrating the social determinants of health into a more holistic care model. Recent advancements, such as the adoption of telehealth during the COVID-19 pandemic, as well as our public health approaches, highlight the profession's ability to innovate while also revealing ongoing challenges such as disparity in digital access. The historical journey underscores the transformative potential of healthcare social work and the importance of confronting these past ethical issues to build a more equitable and just future. Now, when we look at healthcare delivery and social work as well, there are a number of foundational pieces of legislation that guide the practice. We can start first, of course, with the Social Workers Act itself, which at its core defines the profession's scope, emphasizing the importance of addressing the social determinants of health, promoting social justice, and enhancing well-being. This includes clinical services such as assessment, intervention, counseling and therapy, and advocacy. Looking ahead as we migrate to the Regulated Health Professions Act, which is set to take effect in 2027, it'll provide a good foundation for healthcare social work to further be defined and ideally flourish. Other key legislation, such as the Hospitals Act, Personal Directives Act, and Children and Family Services Act, further outline responsibilities like capacity assessment, discharge planning, and of course, upholding child rights. These laws equip social workers and demand social workers navigate complex healthcare systems while upholding the rights and dignity of service users. There are more, again, legislations that guide this work as well. We can look at advocacy and support under the Hospitals Act. Social workers advocate for patients' rights, ensure equitable care, and provide emotional support during critical decisions such as organ donation or discharge planning. Again, there are personal directives in terms of and ethical guidance in terms of the Personal Directives Acts and MAID legislation, which tasks social workers with facilitating informed consent, mediating family disputes, and navigating ethical complexities in end-of-life care. And the Adult Protection Act also focuses on safeguarding vulnerable populations, investigating abuse and neglect, and ensuring access to resources that promote safety and well-being. Again, all of these responsibilities impact and reflect the core goal of ensuring that clients are safe and protected, and that we're addressing systemic inequities. And again, collaborative and holistic care is also a major part of this. Um, Guided with frameworks like the Nova Scotia Human Organ and Tissue Donation Act and the Adult Capacity and Decision Making Act, social workers are advocates for culturally responsive practices, privacy protection, and of course, ensuring that clients have both the right to self-determinate and to empower. Their work is rooted in, of course, education, prevention, policy development, and ensuring that healthcare systems are inclusive and equitable. Again, these frameworks help us to understand the role of social work in healthcare system and how it's defined by our existing laws and structures. And again, the complexity of care is just that, very complex, with different systems to navigate, different needs to meet, and of course, ensuring that at the center of all of that is client and family-centered care. So as I mentioned, over the last year, we've engaged with a number of groups to better understand how they're perceiving social work and healthcare. These groups, again, were consulted on in a way that built some cultural responsiveness in, making sure that the setting was safe, that we worked with partners to help us engage. And we asked broad questions in regards to their experiences with services and social workers across the board. And then from that, provided some themes and insight into what was heard. So again, I want to take some time just to express what we did here. We engaged with our partners at the Mi'kmaq Native Friendship Center and are continuing to talk to Mi'kmaq communities across Nova Scotia. But there is definitely
Can
an
we do
urgent...
it on this?
In these consultations, there's an emphasis on the urgent need to ensure cultural responsiveness and accessibility in healthcare services that respect traditions and address systemic barriers. Key priorities that we heard about including integrating traditional ceremonies and healing practices, such as smudging and circle ceremonies, into healthcare settings to build trust and improve care and to ensure that we are meeting the needs of our diverse population, particularly Mi'kmaq peoples. Addressing long wait lists and systemic discrimination in mental health services, being a core part there, very hard to continue to get services and see services, and implementing trauma-informed care that address intergenerational impacts of colonization and residential schools, and ensuring, again, that social workers receive mandatory training in regards to truth and reconciliation and decolonization. Were some of the core themes we heard. We were grateful to partner with our partners at the Association of Black Social Workers who engaged in kitchen table conversations across Nova Scotia with the African Nova Scotian community. And again, a clear call for culturally responsive social work care came here. Some of the key concerns that were raised were dismissive treatment when accessing services. Again, that undertone of not trusting or of white privilege and supremacy, not acknowledging the lived experiences of African Nova Scotians, particularly when receiving health. Also, the need for mandatory training on anti-racism and Afrocentric practice came up within these consultations. And also recognizing that within a regulatory body's complaint process, that these aren't particularly designed for vulnerable peoples to be able to feel safe in delivering accountability across the board. Again, our African Nova Scotian community partners also emphasized the need for strong Black-led organizations and called for increased funding and resources to support this work. We engaged with our Acadian and Francophone communities as well, an often very underserved population in Nova Scotia. who've had significant challenges in accessing both social and health services, particularly due to language barriers. The lack of French language support in critical areas like hospitals in different areas of social care often leads to further trauma and further health risks, as oftentimes that creates an isolation for folks. It's also a cultural isolation that was talked about, particularly from Acadian folks who are looking to engage in adoptive services or child welfare services in which none of the assessments they found were available in French-speaking environments. But again, some of the recommendations that came from this group was a more deliberate effort to recruit Francophone staff, provide further French language training, and making sure that core documents are available in French, as well as ensuring that social workers themselves understood the history here in Nova Scotia of the Acadian communities. We engaged with representatives from seniors community, and they really emphasized the need for social workers to play a more prominent role in long-term care and highlighted key priorities such as having full-time social work positions, also recognizing that social workers can play a core role in assessing dementia and its impacts on quality of life, and recommended that social workers who are in the long-term care sector engage in ongoing dementia training, particularly updating these services. There's also a real call for family-centered care and involving families in care decisions, as well as providing emotional supports, which these consultations thought social workers could play a strong role in. And trauma-informed care was highlighted here again, ensuring that we particularly help seniors process trauma and engage in healing. We heard from our disability community in regards to the significant barriers that they face towards equitable healthcare services, such as even having the need for clear communication about available services they might be able to engage in, and overall simplified processes in terms of accessing care and supports. They also called for greater acknowledgement and education by social workers of both visible and invisible disabilities and how they impact care and overall well-being. And there is a need for advocacy for there's a need for advocacy for employment opportunities for more inclusive healthcare guidelines and ultimately to ensure that we're supporting folks with disabilities engage in social inclusion and in their communities. We heard from two SLGP, 2SIA youth from the Youth Board and our friends at the Youth Project. Again, there's a real strong call for equity, fairness, and inclusive practices. Some of their key recommendations including creating frameworks and practice processes and programs that address barriers like transportation and exclusion within the community. Also, what was called for here is the need for greater staff retention, recognizing that having different care providers along the journey and constantly having to re-educate created harm and was not something that this group particularly felt particularly great about. And they also made it clear that when it comes to wellness checks, that these should be free from police involvement to avoid re-traumatization. We also spent a lot of time talking to newcomers with our partners at ICANS and the significant challenges that they face, of course, including language barriers, limited access to mental health, particularly culturally appropriate mental health, as well as real challenges with housing, access to housing, and how landlords treat newcomers in that field. And of course, needing support to culturally adjust to areas that they're facing in terms of just navigating the healthcare system and the social care system on top of that. We also, while we were doing this work, were all struck by the report from the IWK in regards to women's health overall. And we know that this has to be a core focus moving forward. To those who may not know, this was a pretty groundbreaking survey that engaged over 27,000 people, women in particular, to capture their experiences in receiving healthcare. There's a range of structural and societal obstacles impacting women's health that continue to both limit access and quality of care. And findings highlight the need for clear priorities and solutions to overcome these challenges. Some of the data there shows that 77% delayed or avoided care due to fear of judgment, dismissal, or caregiving responsibilities. 70% felt that the healthcare system did not meet their needs. And these numbers highlight the persistence of systemic and societal barriers in women's healthcare and echo the overwhelming finding that 86% of participants are calling for significant reforms to improve access, experience, and outcomes for women. Many respondents reported about caregiver burnout, economic insecurity, while a significant number described having their health concerns dismissed by medical professionals. Access was another major issue, with 28% unable to see a family doctor, and difficulties also reported in reaching walk-in clinics and specialists. The emotional burden of these barriers was clear, as 65% of women experienced challenges related to mood and emotional well-being, underscoring the urgent need for reforms here. Only 34% of women rated their health as good or great, reflecting the deep and widespread challenges in delivering healthcare, which, again, delivering healthcare to 50% of our population. We need to really dramatically see a strategy and a different approach in how we deliver services here. And of course, the need to expand access, women's health clinics, providing gender-specific education and training for providers came out as recommendations in this report. And again, the need for a broader systemic approach to how we tackle women's health care in this province. So we also, for this process, were able to interview every single one of our healthcare community members and synthesize the data that they shared and what they're experiencing within the delivery of healthcare and social work. So the healthcare committee were interviewed, and there were significant challenges that were revealed here. Some of them include a lack of role definition and consistency. A dominant theme was the absence of a clear framework defining social work roles. The lack of clarity has led to inconsistent job descriptions and expectations, often dictated by non-social workers. Additionally, the distinction between BSW and MSW roles remain unclear, leaving BSWs in some situations to manage complex cases without adequate supervision or support. Limited supervision came up as well. The absence of social work specific management positions or designated union understanding social work has left many practitioners without the guidance they need, and opportunities for debriefing, peer support, and professional development were deemed as scarce, exacerbating the challenges of working in high pressure environments. Resource constraints also came up. Social workers consistently reported insufficient time and resources, often due to systemic underfunding, and these constraints limit the ability to affect care and contribute ultimately to professional burnout. It was also reflected that there is a siloed approach and fragmented collaboration, and social workers reported frequently operating in isolation with minimal integration into interdisciplinary teams. And this siloed approach undermines the potential for holistic care and limits the ability to contribute meaningfully to healthcare outcomes. So again, when asked about a vision for what healthcare could look like within the healthcare system, what members said of the committee was that they envision a healthcare system where social workers are fully empowered and a system that values and respects the profession's scope. In this vision, this included that social workers are integral members of the interdisciplinary team, equipped with time and resources needed to provide competent, compassionate, and client and family-centered care, and that healthcare systems align with the social work code of ethics, prioritizing equity, cultural responsiveness, and systemic advocacy. Communities are supported by confident, well-trained social workers who address the social determinants of health. However, respondents emphasized that systemic issues such as poverty, housing instability, and equitable access to resources also have to be addressed for this vision to come to life. Without tackling these challenges, again, social workers will fall short in meeting the needs of vulnerable populations. So in terms of charting the path forward and what this looks like, the insights from the Healthcare Committee highlight the need for a regulatory framework to address the risks and challenges facing healthcare social worker by identifying roles, expanding support structures, and fostering collaboration. By doing this profession, we believe we can establish a more cohesive and impactful presence in healthcare. And the framework emphasizes also the need to prioritize political advocacy and systemic change, empowering social workers to address the root causes of inequity and build healthier, more resilient communities. And so, again, the navigating of these social systems has become complex, and the ethical delivery of social work and healthcare has many challenges embedded, of course, in the organizational and systemic dynamics. And social workers often operate within these systems, and the complexity of both the hospital bureaucracies, the need for community resources, the interdisciplinary teams, and of course the complex needs of service users. And acting as intermediators, they're tasked with ensuring patients receive coordinated care while managing all of these hurdles. These ethical dilemmas and logistical challenge often occur because of the fragmented systems that can lead to delays in care and miscommunication. And of course, we see ethical challenges often balancing a commitment between service user welfare and their rights and constraints imposed by institutional policies and limited funding. Additionally, how we operationalize the social determinants of health through poverty, addressing poverty, housing instability, and food insecurity was identified as a major ethical issue that we need to continue to advance and work on. So we also had a review of the literature, which helped us understand a number of core areas that were being framed there as well. Some of them also identified by the Healthcare Committee itself in terms of the impacts on patient care and the tension that exists between institutional policies and social work values, the underfunding, particularly of social care across the board, and the tools that this leads to, and overall the tension that this creates within ethical social work practice. Again, within these complex systems as well, particularly as we introduce new electronic health records and digital communication, have created new complexities in maintaining patient confidentiality in terms of ensuring competent and ethical and collaborative care as well, ensuring that folks and teams are working well together. And of course, the continued call and the demand and the moral and ethical requirement to deliver culturally responsive services in critical areas. Again, there's a lot on the agenda and a lot to manage within healthcare social work. And all of that, of course, is impacted again by a lack of understanding of social work within this care environment, which ultimately leads to real challenges in how the scope is utilized, how we assess and ensure folks have the competencies to provide the care in the system, and even orders of operation sometimes in terms of where a social worker best fits and how we might be able to impact care in a new or even better way. We also know, again, of the challenges related to managerialism and the continued push towards having non-healthcare providers and systems of leadership who don't understand always the frontline responsibilities or impact of delivering healthcare. So where this leads us and what this looks like across the board is, again, we do believe and we have a sense that we can implement some regulation that would support healthcare social workers in clarifying these roles, help employers determine how we can best impact the use of social work and social care, and ultimately to be able to ensure that, again, there are core tools that help social workers as well navigate these complex systems. So using all of this data, as well as doing other environmental scans, what the Health Committee and the college is proposing is that we do strengthen regulation, and the Regulated Health Professions Act, as we migrate there, will support this, as scopes are more defined in the Regulated Health Professions Act by competencies and standards of practice. So what we'd like to be able to do is define a scope of practice across healthcare settings, establish core competencies for both general and advanced practice, and then develop specific standards of practice related to the delivery of healthcare social work. What this would include, again, is a recognition of all of the areas of practice that social workers work in within that scope. Again, from primary care, where social workers are addressing social determinants of health to provide psychosocial, spiritual support and advocate for equitable access to services, to the acute care environment, working on, again, crisis intervention and social supports, to mental health care, looking at therapeutic interventions, and long-term care as well. The idea is we would have a scope that captures the theme that runs through all of these different positions, but that also creates some differences within them as well. We also believe that we need to define the competencies related to general practice, which is generally defined by holding a BSW, and those in advanced practices. And our preliminary scoping has us believe that within general competencies, social workers should have clear skills to conduct biopsychosocial spiritual assessments, be able to develop interventions based on that assessment, practice through a culturally responsive lens, provide trauma-informed care, and navigate systems and referrals. And again, we define them both as BSW and competencies, because again, competencies can be developed outside of that academic learning as well. And we believe that this pathway will allow for assessments in either one of these competency sets. And then again, what is being proposed in terms of advanced practice, which is generally MSW practitioners, that there be, again, specialized training in areas of harm reduction, dementia care, assessments related to therapeutic intervention, and complex case management. So a distinction there between those two competency sets. Ultimately, too, what was discussed is the need for clearer standards in a number of areas that run through healthcare and that are directly tied to the complexity of delivering healthcare in this setting and environment. These include things like palliative care, establishing standards for compassionate patient-centered care for individuals with life-limiting illnesses, focusing on comfort, dignity, and quality of life, to grief support, offering structured approaches to help individuals and families navigate emotional, psychological, and social impacts, to harm reduction, implementing evidence-based strategies to reduce risks and promote safety, to cultural responsiveness, ensuring inclusive and respectful practices that are tailored to diverse cultural identities, which would include specific provisions for delivering services to Indigenous peoples, people of African descent, Acadian populations, and some of the many other groups that we've engaged with and encountered, as well as clear standards and guidelines related to intimate partner violence within the healthcare setting, establishing guidelines and standards related to interdisciplinary collaboration, promoting teamwork and effective communication, and ultimately strengthening the standards related to social determinants of health and the role of social workers in both assessing and understanding these areas. Additionally, supervision and how we deliver supervision in healthcare would be another useful standard that we're pitching here. Ultimately, it is our hope that what this regulatory framework could achieve, if we get it right, and again, we want to take the time to get it right, is to have a greater clarity in roles to prevent role confusion and ensure alignment with professional expertise, enhance support, establish standards for supervision, peer support, ultimately to help reduce burnout and hopefully improve some job satisfaction, Ultimately, empower the role of advocacy within social work in the healthcare setting, uh, prioritizing equity and social justice, and enabling social workers to address the root causes of health inequities, and ultimately to build greater public trust. And that standards that build some accountability and that help us communicate the role in a clear way. It is our belief, and our conversations over the next couple of months want to flesh this out a little bit more, that this approach would be helpful, supportive, as well as achieve the goals of greater public safety. So that's the end of my presentation, and all of this is outlined in a core paper as well with more detail that is available on our website. So I recommend checking that out as well. So what I'm going to do now is I'm going to stop the recording, and then I have, with our time remaining, some questions back to you, as I'm interested in hearing your thoughts on this approach at this point in time.